National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. A major concern for a number of my patients is infertility. Now, infertility is characterized by inability to conceive after 1 year of trying, or if you've had multiple miscarriages in the earlier stages of pregnancy, that also classifies as infertility. Now, understanding infertility, it's a major area to focus on, and so I'm just going to cover a few of the key causes behind infertility. One of the most common causes is actually another disease known as hypothyroidism, where your thyroid gland is underactive. And one of the effects of this is it actually creates stress on the body, hormonal imbalance, and infertility. So one thing I often recommend patients who are struggling to conceive to do is ask their doctor to test their thyroid to ensure that function is adequate. And if they have a lot of the symptoms of hypothyroidism, fatigue, weight gain or inability to lose weight, depression, constipation, thinning hair, dry skin, and thinning of the eyebrows, I'll often look at supporting their thyroid to ensure that they are, maximally capable of conception. Other things that are related to infertility are imbalances in estrogen and progesterone. If your hormones are out of balance, that's going to create infertility. In order for conception to occur, you need, a healthy egg to be released. It needs to, connect with a healthy sperm, and then those need to implant, the zygote needs to implant on a healthy uterine wall. So encouraging health of all of these systems is really important. And if your hormones are out of balance, that may change the way that the egg matures. It may interfere with maturation of the egg, and as well as it can interfere with the normal growth and development of the uterine lining. And both of those things are required for successful conception. So things you can do to stabilize your hormone levels, I often recommend, especially in women that have low estrogen levels, is to supplement with something called Quai or Angelica Sinensis. This is a herb traditionally used in Chinese medicine, but it's very effective at helping balance out women's hormones, especially when they tend to be deficient. Now, if hormones tend to be excessive, that's typically when I'm going to treat with DIM or diindole methane, and this chemical typically found in your broccoli, cabbage, cauliflower, or the brassica family of vegetables helps your body to eliminate excessive estrogens and helps ensure normal production of estrogen, and it prevents the overconversion of progesterone into estrogen. You see, in order for a conception to occur, you need to have an elevation of progesterone, and it needs to be maintained. If too much of your progesterone is being converted to estrogen, that there can cause spontaneous abortion or what we call a miscarriage oftentimes. So ensuring, again, adequate progesterone levels, ensuring adequate thyroid hormone levels is really important to ensuring adequate fertility. So get those things checked out. I highly recommend working with a physician to ensure that all physiological causes of infertility are ruled out. Other causes are nutrient deficiencies. For instance, a selenium deficiency is associated with infertility in women. So supplementing with selenium may be very effective at helping with normal production of a baby. Also, too, looking at iodine. Iodine is needed for fertility. It's also needed for healthy thyroid function. And then in addition to iodine, you want to also consider supplementing with things like iron and folic acid to ensure that your blood is healthy enough to be able to transport nutrients to the developing baby to prevent things like spontaneous miscarriage. Other things to consider if you're trying to conceive is a good prenatal vitamin. Why these are so important is, of course, you want to ensure nutrient adequacy. Again, nutrients are the things, the molecules required to support and sustain life in the absence of disease. So to ensure healthy fetal development, you want to make sure you've got adequate nutrition, and a good prenatal is a great way to ensure this. And I typically recommend to most of my patients to actually start this a year before you try to conceive. The reason is if you have a deficiency, it's going to take some time to repair that deficiency. So prepping your body, making sure you're as healthy as possible before trying to conceive is really going to increase your chances of fertility. So if you've struggled with infertility, speak with your doctor, get tested, make sure that you don't have hormonal imbalances, make sure you don't have hypothyroidism, and consider supplementing with things like iodine, selenium, folate, and iron to ensure that you don't have any deficiencies which may be interfering with your success. So if you find this video helpful, check out more of the videos on our channel, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.